Myocardial infarction, commonly known as a heart attack, is a serious medical condition where the blood flow to a part of the heart is suddenly blocked, causing tissue damage or death due to lack of oxygen. The classic symptoms include a feeling of pressure, tightness, or pain in the chest, which may spread to the arms, neck, jaw, or back, and is often accompanied by shortness of breath, sweating, and nausea. Some individuals, especially women and those with diabetes, may experience atypical symptoms such as fatigue or abdominal discomfort, making prompt recognition and diagnosis crucial. Treatment options for a heart attack typically involve a combination of medications, lifestyle changes, and potentially surgical procedures like angioplasty to restore blood flow. Risk factors for experiencing a myocardial infarction include high blood pressure, high cholesterol, obesity, smoking, a family history of heart disease, and a sedentary lifestyle. Here's a detailed look into the various aspects of myocardial infarction versus a heart attack and the implications for an individual's health. Affected process: acute blockage versus sudden insufficiency. Myocardial infarction, MI, and a heart attack may sound synonymous, but they cover slightly differing ground. MI specifically refers to the death of heart muscle due to prolonged lack of oxygen supply, which happens when there's a persistent blockage in the coronary arteries. It's a pathological term confirmed by lab findings or imaging. On the flip side, a heart attack is a broader term that the public usually uses to describe any acute cardiac event. It indicates sudden heart insufficiency, which could be due to MI or other causes like a spasm in a coronary artery. Prompt distinction between these conditions is crucial for effective treatment and can influence the immediate interventions, like the administration of clot-busting drugs or coronary angioplasty for MI, aimed at restoring blood flow to the affected myocardial region. Underlying causes: coronary artery disease prevalence versus broad cardiovascular conditions. While myocardial infarction, MI, and heart attack are terms often used interchangeably, they reflect a more nuanced relationship in the clinical context. MI is a pathological diagnosis characterized by the death of heart muscle due to prolonged ischemia, typically caused by blockages in coronary arteries from plaque buildup, a condition known as coronary artery disease, CAD. This is the most common underlying cause and is often symptomatic of chronic, advanced cardiovascular disease. By contrast, a heart attack can be caused by various cardiovascular conditions beyond CAD, such as a spasm of a coronary artery or embolism caused by a blood clot originating from elsewhere in the body. The prevalence of coronary artery disease as a cause underscores the importance of managing risk factors like high cholesterol, hypertension, and smoking to prevent the pathology that most frequently leads to a heart attack. Symptom onset: rapid versus instantaneous. Myocardial infarction, MI, usually presents with sudden chest pain that may spread to the arms, back, neck, or jaw, often accompanied by shortness of breath, nausea, and sweating. However, the onset of symptoms in MI can be variable. Some may experience rapid onset, where symptoms escalate quickly within minutes, while others can have a more gradual increase in symptoms over hours. In contrast, the term heart attack is often colloquially used to refer to a sudden event, implying an instantaneous onset. This perception might result in people expecting a dramatic, unmistakable event, which is not always the case with MI. Understanding the variability in symptom onset is crucial as it affects how quickly individuals recognize the issue and seek medical attention, directly impacting the prognosis and outcome of the disease. Typical duration: hours to days versus immediate transient event. Myocardial infarction, MI, and heart attacks are often conflated, but the terms have nuances. An MI refers specifically to the death of heart muscle tissue due to prolonged blood supply blockage. This event typically unfolds over several hours to days, with a gradual onset of symptoms such as chest pain, shortness of breath, or fatigue. On the other hand, a heart attack might colloquially refer to any sudden heart-related episode, yet medically it usually aligns with an MI. Sometimes, however, the term heart attack might be wrongly attributed to transient events like panic attacks, which, unlike MIs, come on rapidly and resolve relatively quickly without lasting heart damage. Understanding these distinctions is crucial for both medical professionals in diagnosing and treating patients, and for the public in recognizing the urgency of different cardiac events. Potential complications: arrhythmia risk versus full cardiac arrest. In comparing myocardial infarction, MI, to a classical heart attack, understanding potential complications is crucial. Both events may lead to serious arrhythmias, where the heart beats abnormally. In the case of MI, depending on the infarct's size and location, the risk of developing an arrhythmia can be significant. This disturbed electrical activity can deteriorate into more dangerous forms, like ventricular tachycardia or ventricular fibrillation, potentially causing sudden cardiac arrest. Therefore, while a heart attack is often a lay term for MI, the distinction is vital for anticipating the after effects. Full cardiac arrest represents a severe evolution where the heart ceases to pump, demanding immediate medical intervention to prevent mortality. Early detection and management of MIs are pivotal in minimizing the progression to life-threatening cardiac complications.